Hi, I'm Guy DiMartino. I'm an injury and accident lawyer, and today I'd like to spend a few moments and share with you why I do what I do. Now, in order to do that, I am going to share a personal story that started a few weeks ago. It was 3 o'clock in the morning. It was a Wednesday morning. I remember that. I was laying on my left side in bed, and I felt this cramp on my left side of the chest. It woke me up. I didn't know if I slept funny, if I did too much in yoga the night before. My dog was on the bed. Maybe I was curled around the dog. But you want to know something? The pain didn't go away. And me, I'm an educated healthcare consumer. I'm a chiropractic physician. I do medical malpractice work in my practice. I have a family history of heart disease. I said, you know, Guy, you better go and get it checked. You are going to be 50. You're going to be a grandfather soon. Why don't you go and be safe and get yourself checked out? So I went to a cardiologist who I know and have a relationship with. I chose this cardiologist because she's an athlete, and me, myself, I am an athlete. And when I went to the cardiologist, we set up a relationship. The relationship was that of a doctor and a patient. She required of me certain things as a patient, to be open and honest and give her information and to follow her directions. I required of her, a doctor, to practice within the standard of care, to give me time, to give me consideration, to use her expertise to properly work me up and diagnose me if I have an underlying problem, and then give me the appropriate treatment options so that I could make the appropriate decision for my health. So she evaluated me, took an EKG, recommended an exercise stress test the following week. That was the Friday before Labor Day. I know about an exercise stress test. I know about the Bruce protocol. I've done it before. I did it when I was in chiropractic college in exercise physiology class. I went on the treadmill. I got my heart rate up to 100% of maximum. I didn't have any chest pain. My blood pressure responded normal. I said to myself, man, you just killed that test. I leave the office. I get cleaned up. About an hour later, I receive a phone call from somebody from the office. And the person tells me, Dr. So-and-so recommends that you don't do any vigorous activity this weekend. You had an appointment for 2 weeks, but she wants to see you the following Wednesday. I said, uh-oh, what's going on? I took care of myself that weekend. I went in and spoke to the doctor, and she explained to me, she said, Guy, you don't have a typical pattern of anything that's going on, but I see some changes there that I'm concerned about. It could be nothing, but it could be something. I want you to go ahead and do a nuclear stress test. I said, you're the doctor. I am going to do what you tell me to do. I am relying upon your expertise. I was given directions. Yesterday, I went in for the exercise stress test with the nuclear component. I wasn't supposed to have caffeine. I wasn't supposed to eat. I was supposed to drink a certain amount of water and this and that. I was a compliant patient. I followed directions. I was in the office for 3 hours. I came in contact with exercise treadmill techs. I came in contact with nuclear medicine techs. I leave the office and I receive a phone call from my dad. My dad says, Guy, how did the test go? I said to my dad, Dad, they let me leave the office. My expectation was that if there was a significant problem or something that was alarming, that they would not have let me leave the office. So I said, everything so far seems to be okay, or it is not an emergency. That was my expectation as a patient. The standard of care would require the doctor, if there was an emergency, to go ahead and not let me leave the office or call me back to the office or tell me to go to the hospital if I was having some emergent condition. So now my next expectation is this. that the cardiologist who reads the MyoView study takes their time, is focused on the test, looks at all the information, and reports and interprets what they see accurately. That they communicate the results to the cardiologist if it is not my cardiologist who's looking at the test. And if the test shows something, that they timely report the findings to me so that I could make an educated decision on what's next regarding my health care. Is that too much for patients to ask? For the doctors to take time, use their experience, and focus on whatever the problem is in front of them, and then report to them, give them treatment options, and go ahead and make their treatment recommendations. Isn't it the same thing as if you are driving down the street and you expect other drivers to stop at red lights or stop at stop signs before they go through the stop sign? You see, in society, we all have reasonable expectations. We're all required to act as a reasonable person under the same or similar circumstances. Now, I didn't drop dead last night, so there was no emergency. But if the doctor should do something wrong, and I should be injured, or I should pass away, shouldn't my family be entitled to compensation for the loss if the doctor misinterpreted the test or failed to communicate the results to me? I am an educated healthcare consumer. I do what I do because there are many folks who are not in my position. They need somebody to stand up for them. They need somebody to fight for them. They need somebody to be their voice when somebody acts unreasonably and causes injury or death. I'm Dr. Guy DiMartino. I am an injury and accident lawyer, and that is why I do what I do.